Hello, I'm honored to be here with Ethiopian Foreign Minister Dr. Tedros, and he's known around the world as one of the leading figures in global health. He's been a champion of that for many years. And I want to ask you today, Dr. Tedros, Ethiopia is making impressive progress on so many different fronts, but when you're a foreign minister, when you're in office, there's so many different challenges, so many different things you have to prioritize. Why is universal health coverage important to you when there's so many other things, education and et cetera? Could you share your thoughts, please?
Yeah, universal health care is a priority for us because we believe that it's a rights issue. And second, it's also a means to development. So we should provide it as a rights issue, and then it's a healthy society that can also transform our country. So we should use it also as a means to develop or prosper our country. So we have these twin goals connected to each other, and that you cannot really miss, and you shouldn't miss to use the two. And the other element is, if you see health, all the problems are related to, the marginalized, the poor, and so on. So having health as a priority means your agenda or policy is also proper. And not only health in isolation, we can see it as a pack, for instance, with education, agriculture, and also industrialization, especially micro and small enterprises. So our budget, 70% of it goes to health, education, agriculture, smallholding farmers, and industry, micro and small enterprises. And the micro and small enterprise to create jobs in urban areas, agriculture to create jobs in rural areas, and then education, and then health. These four actually pro-poor and trying to really help the marginalized and the poor, even in terms of budget. So it emanates from our government's policy and strong commitment to really have inclusive growth, equitable growth, and that's why we're spending a lot of our money on pro-poor areas, and health being the central one.
So what is the key lesson that other developing countries should take from Ethiopia's success with health programs?
The key lessons would be, one, political commitment is necessary. It's with political commitment that the two twin things I said came. It's a rights issue. Health is a rights issue, plus it's a means to development. Healthy society will have the workforce to really change, transform its country. And then that's maybe can be left as a slogan if you don't act. So the other thing is political commitment should be accompanied, not just the lead slogan or so, but to translate that into action. That's why our government developed, this ambitious plan, achieving universal primary health care in 5 to 7 years. This is some years ago. And then we did it, and it was on time. Each and every village is covered now. And, as a result of the expansion of the primary health care, we have achieved almost all MDGs, and life expectancy has increased in the last 20 years alone from 45 to 64. This is significant, and fertility rate has declined significantly from 7 point something to 4.1, and family planning rose. So not only the diseases we know, like the HIV, malaria, TB, combined, we achieved MDG on those also, but the other indicators like life expectancy and so on has also increased significantly. So you see a very significant, palpable change in Ethiopia, and that's to political commitment and also our focus on building the health system, which is now getting robust, and we can use it for many areas of the health sector.
And I understand you've been the key person in maintaining that political commitment.
It's a team, especially when there is political commitment. The whole from top to bottom, the grassroots even ownership is key. So it belongs to everybody, and not only the political leadership at the top, but the grassroots ownership of also of the programs. And that's why millions became executors. They didn't wait for us to provide something to them. With some of the knowledge we transferred and skills, they started doing it. So I think that kind of community ownership and mobilization and action is very important. It really changed the whole situation.
I think you've laid out a model that all of us around the world have to emulate. Thank you so much for your time.
Thank you.
It's a real honor.
Thank you for having me.
Thank you.
Thank you so much.